Welcome to the 3M training program for the proper donning and fit testing of the 3M healthcare particulate respirators and surgical masks. In addition to being cleared by the Food and Drug Administration, or FDA, as surgical masks, these devices are also approved as N95 particulate respirators by the National Institute of Occupational Safety and Health, or NIOSH. In the United States, the Occupational Health and Safety Administration, or OSHA, establishes and enforces regulations and standards to help protect employees by preventing or controlling occupational health and safety hazards, including the use of respirators in the workplace. The OSHA respirator standard requires that a written respiratory protection program that addresses employee training, medical evaluation, and respirator fit testing be implemented when respirators are required to be used in the workplace. Choosing appropriate respiratory protection is one important aspect of reducing the wearer's exposure to airborne biological particles. An effective respirator program, including fit testing and user seal checks, is required to ensure optimal respirator performance. When fit tested and worn properly, the respirator is designed to help reduce potential exposure to airborne particulates, including airborne pathogens, but does not eliminate the risk of exposure, infection, illness, or death. This program reviews certain elements of proper usage for the 3M healthcare particulate respirators and surgical masks, including donning, conducting a user seal check, and fit testing instructions. The fit tester should read and understand the instructions provided in the fit test kit. They should also be familiar with the donning and user seal check procedures for the respirator models they are fit testing. A fit test is conducted to establish that a particular model and size of respirator provides an adequate face seal on the wearer. A user seal check, on the other hand, is conducted by the wearer to determine whether the respirator is properly seated to the face. The wearer should perform a seal check every time he or she dons a respirator. There are important differences between a respirator and other healthcare masks. Despite filtration properties of some surgical or procedural masks, these masks cannot be designated as respirators. Respirators need to be fit tested and must meet stringent filtration criteria determined by NIOSH, a federal agency and a branch of the Department of Health and Human Services, Centers for Disease Control and Prevention, commonly referred to as the CDC. NIOSH tests and certifies respirators, carries out in-depth research on safety and health issues, and recommends standards for adoption by OSHA. Look for N95, NIOSH, and the respirator manufacturer printed on the respirator, along with N95 certification label printed on the packaging. Your facility has selected one of these NIOSH-approved 3M N95 particulate respirators in compliance with OSHA standards and CDC recommendations. OSHA prohibits use of respirators when conditions exist that compromise the fit, such as facial hair or any object that prevents contact of the respirator with the skin. See your supervisor with any questions. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators.